Hey everyone, getting my educational video out for the day. I know I talk about this all the time, but I have to continue to hammer this home because cortisone shots have become the standard operating procedure across the board for orthopedic surgeons. So I kind of downplay it over the past couple years, but I just want to get front and center with it. And I want to go over why a cortisone is a horrible idea. I can't emphasize horrible any more than I have. I put 3 lines under that, so you know it's a big deal. So I want to talk about what actually happens when you get a cortisone shot. First off, when you get a cortisone shot, the doctor is just doing the normal standard operating procedure. They know you have a problem, could be in your shoulder, hip, ankle, anywhere, and what they do is they just inject it with cortisone and see what happens. And then you as the patient go, well, the doctor said I'm going to feel better from this shot, so I might as well do that. But what they don't do is tell you what actually goes on. So what I wanted to do was explain a little more in depth about what's really going on when you get a cortisone shot. So when you have pain from an injury, it doesn't just happen overnight, unless you got hit by a car or you fell off your bike or something like that. Most injuries are a repetitive load that goes over time and things start to build up. There's many things that bring you into what's called the painful state. So what I did here was I drew different blocks of dysfunction. Down here would be no pain. Up here we see this ST is what's called symptom threshold. That's where you get the pain and you know something's wrong. It's your body's built-in check engine light to let you know something's wrong. So one thing that can happen is just degeneration, be it to the joint, to the cartilage, or the tendon. That's one bad block in there. The other one is just bad tissue. Over time, when we spend time in bad postures, bad positions, we work out too much, we don't recover, you get bad tissue and your tissue develops a lot of scar tissue in there. The other thing is just high load. High load, what I talked about is, hey, say at your job you got to sit all day, you got a long commute, or you beat yourself up with workouts 7 days a week. All of these blocks built up, they bring you over threshold where you get the pain and your body goes, hey, it's time to pay attention and listen. So what happens with the cortisone shot is it says, hey, I'm going to go in there and I'm going to take away all your pain. You're like, you know what, that sounds great. So what really happens when you get a cortisone shot is this. You get a second symptom threshold. So what you did was you bought a new buffer. Now you have all these problems still in here, but you're not noticing it as much, which is completely dangerous because you still have degeneration, you still have bad tissue, and you still have a high load. Over time, these blocks will continue to get bigger and bigger and bigger. And now you'll start approaching this second symptom threshold. Then you know what else happens? Then they start getting into the bigger, badder, scarier stuff. Opioids, pain pills, burning nerves, injections, all of those things. And the same thing continues to happen. Your tissue continues to degenerate, you continue to get worse. And then all of a sudden one day it ruptures on you and you are through the roof in pain and you are no longer able to function. All because you ignored all this dysfunction. Any treatment that only addresses your pain and doesn't improve your function is dangerous. And I don't blame you for this happening. I blame the system and I blame the doctors because they are not setting you up for success. You need to be informed as a patient. You need to know that these are consequences before you go in there and get an injection. So if you're one of these people that are getting endless cortisone injections just so you can get back out there, eventually you're going to have to pay the price. And that price is going to be a lot of pain down the road. So be an informed patient. Ask your doctor questions. Ask someone that's offering a cortisone, what are the real side effects? Take control of your health. Don't let the system ruin you. Thanks for watching, and please feel free to share any comments, send us any questions. We'll gladly answer them. We want people to be better informed, and we want you to take control of your health. Thank you.